My name is Anley Glass-Hicks, and I'm going to talk to you about Phillips County in Arkansas. Myself, Maya Merriweather, Ansley Scott, and Catherine Clark have done a healthcare assessment of the county, over here highlighted in red. We are with the UAMS College of Public Health. The first thing I want to talk to you about is just the overall demographics of the county. It is home to 18,572 people, and 48% of that population fits the definition of living in a rural area. Almost 62% of the population is African American, with a little under 35% being white, and the remaining 2% Hispanic. So first I want to talk to you about just a general overview of the health status of the county. As you can see, for the first 5 bullet points here, for the categories of health outcomes, health factors, health behaviors, social and economic factors, and length of life, Phillips County is either 75th out of 75 counties in all of Arkansas or 74th out of 75 counties. And for all 5 of these factors, they have actually been either last or second to last since 2011, which is as far back as the data we looked at goes. So these categories are areas where Phillips County has had trouble and has not had any improvement. One area where they are improving in is clinical care. They currently rank 58th out of 75, but in 2011 they were 70th out of 75, and by 2014 they had moved up to 60th. So now for the 2019 numbers as they currently stand, they are 58th. So this is an area that they have been improving. Perhaps in response to the low health status of the county, the surrounding area has attempted to improve clinical care, which may show health benefits in the long run. One area where they have greatly improved and are actually in the top 50th percent for Arkansas is physical environment. So what this category includes is air quality, housing, and transit. They're currently 24th out of 75 counties in all of Arkansas, but in 2014, they were actually 72nd. And by 2018, they were 26th, and now, as you can see, they rank at 24th. So this has been a vast improvement in areas such as air quality, housing, and transit. Now I want to talk about some more kind of just hard numbers. I know it's a lot, but I'll try to boil it down to just what's really important. So this is just some more data to reflect the health status of the county. All of these numbers we have compared to Arkansas overall. So there are just under 15,000 premature deaths in Phillips County yearly, and overall in Arkansas that is less than 10,000, so that is significantly higher. 31% of Phillips County is rated as being in poor or just fair health, compared to 24% in Arkansas overall. As you can see here, they have minorly more poor physical and poor mental health days compared to Arkansas overall, but this is not as stark of a difference. One important outcome that is worse in Phillips County is low birth weight, which is at 12% versus 9% overall in Arkansas. Low birth weight is a neonatal complication that can lead to many health problems, and so it is something that is very important to try to lower. The life expectancy of somebody living in Phillips County is 71.6 years old versus 75.8, almost 76 years old overall in Arkansas. So that is significantly different. Now I want to talk about healthcare access in Phillips County. 8% of the county is uninsured, which is actually one area where Phillips County ranks better than Arkansas overall, as 9% of Arkansans are uninsured. This could be in part due to the Medicaid expansion that came with the Affordable Care Act. And we will discuss more about the Affordable Care Act in the next few upcoming slides. As far as access to providers, Phillips County does have less access to providers than Arkansas overall. This includes primary care physicians, dentists, and mental health providers. The difference in mental health providers is not as different from Arkansas overall compared to the physician and dentist shortage. So just one example you can see there, for every 2,710 people, there's only one physician available in Phillips County, whereas in the rest of Arkansas, there's one physician for every 1,500 patients. There is one hospital in Phillips County, the Helena Regional Medical Center. Helena is the largest city in Phillips County. Now I want to talk about the impact of the Affordable Care Act. The first mandate I'm going to discuss is the Preventative Health Services mandate, which requires that preventative healthcare services are free to people that do possess insurance. These services include immunizations, annual wellness exams, and screenings at those annual wellness exams for blood pressure, obesity, cancer, and cholesterol. So this is very important because preventative illnesses are very prevalent in Phillips County. 45% of the county is obese, 26% of the county smokes, and 19% of all motor vehicle deaths in the county are attributed to alcohol. So it's also important to discuss maladaptive behaviors when talking about this mandate because they are prevalent in Phillips County, and annual wellness exams screen for those behaviors, and there's important patient education that goes on to explain why these behaviors are maladaptive for your health. So as far as cardiovascular disease goes, which is also preventative in many ways, there are higher rates in Phillips County for both females and males compared to the U.S. overall. 205.8 females per 100,000 women have cardiovascular disease in Phillips County, which is almost double the 124.9 per 100,000 women in the U.S. overall. And for males, the rate is also almost double, with 376.2 males having cardiovascular disease in Phillips County compared to 191.5 in the U.S. overall. So in this way, this mandate frees citizens up to be able to go get annual doctor's appointments and not just go to the doctor whenever they already have something severely wrong with them, which is what a lot of people without insurance or who can't afford co-pays and things like that do. So this way they can catch health problems and chronic illnesses like diabetes, obesity, hypertension, and treat them before they culminate in serious health issues that can result in death and also extremely high medical bills. So now we also want to talk about potential negative impacts. So now, moving away from the Affordable Care Act, we want to talk about something that we think could greatly improve the health status of Phillips County overall. So basically, it is a community clinic that we want to have telehealth and different types of providers inside one clinic that can address the community health needs and immediately increase the access to healthcare of all the residents of Phillips County. The goal of which being to improve long-term health outcomes. So the funding we could get to use to do this clinic would be a rural health grant. As we already know, 48% of the population of Phillips County is classified as rural. So that is a potential source of funding. We also could get public health funding, and we could also partner with UAMS and get funding through that partnership. So speaking of partnerships, we could partner with UAMS, create a UAMS East campus or expand it, and we could partner with the Arkansas Department of Public Health and as well as potentially the hospital there, the Helena Regional Medical Center. The clinic could have a board of operations that sort of consists of one member from each organization that is involved in the clinic, that's funding the clinic, that has people or workers practicing inside the clinic. So somebody from UAMS, somebody from the Department of Health, somebody from the hospital, Helena Regional Medical Center, maybe somebody from Arkansas State Hospital because we also want to get mental health on board, somebody from Phillips County, just like their admin office, and then perhaps the Helena mayor or somebody from the mayor's office. In this way, the board will have sort of a medical view of things, an administration view of things, and also a local view in order to know that we are doing what the county and the town of Helena really need. So this clinic would be a Monday to Friday clinic, possibly some weekend hours depending on how much participation we get, but for sure it could be open from 8 a.m. to 5 p.m. and it can be staffed from resident physicians from UAMS on their East campus, and people from the main campus can rotate through to get a rural health experience. UAMS always has physicians that need training, and the shortage of primary care doctors should be addressed, and this is one way to kind of help fill that gap. Overseeing attendings could be from UAMS themselves, and also people from the Helena Regional Medical Center could maybe work at the clinic 1 day a week, depending on what specialty we have going that day. But we also want this to be a multidisciplinary team. We can get community health workers, which are trained by the Arkansas Department of Health. They make sure they have appropriate certification. And these are people that can help regardless of what providers we have in that day. We want to have social workers on staff to address patient needs after they leave our clinic, people who can help them get into appropriate living situations, make sure their insurance will provide physical therapy if they need it, and things of that nature. And then we can also potentially train nurses and have the nursing staff be in the clinic as well. And this can also be people from the UAMS nursing program and also any other regional programs that might be nearby. So this slide is a potential schedule, but more importantly, it's just kind of to show you the sort of training schedule that will be going on in the clinic and how we kind of wanted to run where it has different focuses throughout the week and addresses potential needs within the community and how that can be adjusted if you see that there's maybe another kind of specialty or area of medicine that needs to be reached. So in this potential schedule, we have like Monday being a pediatric day, so we can have pediatric residents from UAMS and then maybe one attending either from UAMS or from a local clinic, the hospital. It is always important to address primary care, so that's why we think we should have 2 full days, Tuesday and Thursday, perhaps dedicated to family medicine, to general medicine. We can have many students training in this area, and we can have 2 attendings. That way we can really get in a lot of patients and do the most good. Another thing is that Phillips County has this problem with having a higher rate of low birth weight babies compared to Arkansas overall, so we want to make sure that women are getting important pregnancy and prepartum care in order to ensure that their pregnancy is healthy and goes to full term. So we would like to have 1 day, perhaps Wednesday, dedicated to an OB-GYN clinic, and this can also have residents and an attending there to see patients throughout the day. As we saw, there is a significant shortage of dentists throughout Phillips County, so we can have 1 day perhaps dedicated to dentistry, or at least part of a day. And we could partner with schools to help train students in this area as well, and perhaps get a dentist from the area or multiple dentists from the area interested in providing more help to the community. So Monday through Friday, we could have psychiatry. We can do this as a telehealth. Another thing we can do as telehealth would be neurology, specifically to address like potential stroke or consult on strokes. Maybe somebody comes to the clinic with symptoms that they should be going to the hospital for, but the physician they're attending needs to speak to a neurologist to really know. They don't want to send somebody for something unnecessary. So they can use telehealth to directly speak to people and have just this direct income and extremely increased access to care in this area. So obviously we would have community health specialists working every day. We would have nurses working every day, and we would have social workers there available every day, because no matter what specialty is being done, social work is always something that needs to be addressed. So these are my references. They were also throughout the PowerPoint on the slides that they went. And thank you very much, and I hope that this was very informative.